from BSN 3A. I am Jansel Marie S. Ingesa, and for today's return demonstration, I will be performing nasogastric tube insertion. So without further ado, let's get started. For the assessment, first we have to determine if it is really a doctor's order for us to perform the right procedure to the right client. Next, we have to assess the client's level of consciousness and level of knowledge and understanding. And then, we also have to assess the availability and functionality of the needed materials. Then, check for the history of nasal surgery or deviated septum, then assess the patency of nerves. And then, determine the presence of gag reflex, because those things that have been mentioned may interfere when we insert the tube. And then, we also have to assess the mental status or ability to participate in the procedure. For the planning before inserting a nasogastric tube, we have to determine the size of the tube to be inserted and whether the tube is to be attached to suction.
Prepare equipments including large or small bore tube, non-allergic adhesive tape, clean gloves, water-soluble lubricant, facial tissues, glass of water and drinking straw, 20 to 50 ml syringe or aseptic syringe, basin, stethoscope, disposable pad or towel, and safety pin, and the rest is optional.
For the implementation, first thing that we need to do is to introduce ourselves and verify the client's identity using agency protocol. It could be we can check it on the door tag, bed tag, or the wristband. And then explain to the client what are you going to do. Good day, sir. I am Jansel Marie S. Ingesa, a student nurse from Manila C, and I will be your student nurse from 7 a.m. to 3 p.m. for today. Before we proceed to the insertion of the nasogastric tube, may I know how you're feeling today, sir? Okay, sir, good to know. For the insertion of the nasogastric tube, there is a tube here that will be inserted through your nostril that will extend to your stomach. It will be used for feeding and for the administration of some medications. And if you will be needing to extract something from your stomach or a gastric content, it will be used as well. So, is it clear, sir? Upon insertion, if you feel any discomfort, just please let me know by raising your finger or your hand or by simply tapping me. Is it clear? Are you ready for the procedure? Okay, let's start, sir. Then, we have to assist the client to a high Fowler's position if his or her health condition permits, and support the head on a pillow. And then, we have to place a towel or disposable pad across the chest. And then, we have to perform hand hygiene and observe appropriate infection control procedures, such as wearing clean gloves. After that, we have to provide for clients privacy. It is done by closing the door, window, or the curtains. After that, we have to assess the client's nerves. And then, we have to prepare the tube, support the patient during the procedure. Then, we have to determine how far to insert the tube. Use the tube to mark off the distance from the tip of the client's nose to the tip of the earlobe, and then to the tip of the xiphoid. Mark this length with adhesive tape if the tube does not have markings. Then we have to insert the tube. Lubricate the tip of the tube well with water-soluble lubricant or water to ease the insertion. We need a water-soluble lubricant to be specific because some lubricant cannot be dissolved and may cause complications. And then we have to insert the tube with its natural curve toward the client into the selected nostril. Ask the client to hyperextend the neck and gently advance the tube towards the nasopharynx. If the client gags, stop passing the tube momentarily. Have the client rest, take few breaths, and take sips of water and calm the gag reflex. And then ascertain correct placement of the tube. Aspirate stomach contents and check the pH, which should be acidic. Commonly, pH is 1 to 5. And then confirm by X-ray. And then we have to place a stethoscope over the client's epigastrium and inject 10 to 30 ml of air into the tube while listening for a whooshing sound. And then we have to secure the tube by taping it to the bridge of the client's nose. For the evaluation, we have to evaluate the patient's response to the procedure, and then we have to document the procedure and other important data in the client's chart. And that's it for the third demonstration of the nasogastric tube insertion. Thank you for watching!